I'm here today with Chuck Hubbard. He's been my patient for a number of years. I just want to ask you a few questions. And first of all, Chuck, just tell me how you were when you first came to see me.
My teeth were virtually gone. I had had struggles with poor teeth for a couple of decades, and I had the last of the teeth removed. So basically, I had nothing.
You had nothing, huh? Okay. And if you would, just tell me a little bit about how you were treated here, how we took care of you here.
Actually, I felt like the treatment here was perhaps the best I've ever had in a doctor's office. Throughout my life, very kind, very courteous, and very interested in my progress.
Good, and just if you would, just share a little bit about what the kind of things we did for you.
Well, I mean, just keeping me comfortable, keeping me informed, letting me know the process, and being available for me when I had questions, and you know, I just felt very informed, and I felt very certain about the process.
Okay, and if you would share with me a little bit about the actual dental procedures we did for you.
Well, first off, there was the removal of what teeth were left, and then the process of mapping out the surgery that was going to be done, you know, and then there was the day of the implants, the initial implant procedure, and that went well, you know, minimum of discomfort.
So we did a net of how many implants? Do you recall? I've kind of forgotten.
I'm thinking in the neighborhood of 12 or something like that.
Yeah, your whole lower arch is implant support, and I think you've got 2 implants upstairs.
That's
is that correct?
So it's 10 or 12, I guess.
So you've got on the bottom, you've got teeth that don't come out. They're pretty much as close to real teeth as we could possibly give you. Is that kind of what your perception is?
That's correct. It works perfectly, and at the top, it's a denture that is placed in with 2 locators and 2 implants, and it has functioned quite well. I mean, it's made a world of difference to me.
Well, just tell me a little bit about how it's changed your life. You mentioned earlier it's changed your life. Just tell me a little bit more, if you would, about that.
Well, imagine walking through life and not being able to smile.
Right.
Not wanting to deliver that part of myself to another person.
Right.
The smile. That's to begin with, and of course there are a lot of foods you can't eat when you have bad teeth. And,
right.
You know, I have no limits there, you know, and I can smile whenever I want to.
So you can chew and enjoy your food way better than you imagined, huh?
Oh, it's like having my own set of teeth back. You know,
that's fantastic.
It's been a wonderful experience.
Okay, well that's great, Chuck. I really appreciate you sharing that with us, and I hopefully that will help us help other people.
Well,
and thanks for coming in today, Chuck. Appreciate you a lot.
Thank you.
All right, thank you.